I'm Nicole, and I was diagnosed in December of 2005 with AML leukemia. I was just 14 years old, and I went from being, typical teenager and living my life to being a full-time resident of City of Hope and receiving chemotherapy and blood and platelet transfusions almost every single day.
My name's Kurt. For years I gave blood. I became acutely aware of the need for platelet just over 3 years ago. My sister was a bone marrow transplant patient here at City of Hope. Glad to say she's doing well, but during the time immediately following her procedure, she required over 200 units of platelets. I became familiar with the process at that time and have been giving ever since.
After about 3.5 months of chemotherapy, we found out that my body was resistant to the treatments and that I was going to receive a bone marrow transplant. I was terrified, and I really didn't want to do it, but I knew I had to. And I went through about 2 weeks of full body radiation, and I remember every single day getting blood and platelet transfusions, sometimes even multiple times a day, and multiple bags, from coming off of really harsh chemo, radiation, or prepping myself for, the procedures that I had to go through.
Donating platelets does take a little bit more time than donating blood. But here at City of Hope, the facility does offer TV, movies. I actually like getting a little bit of work done while I'm here. It doesn't take that long to do a double unit of platelets, and you're doing a good thing. It does save lives.
Every unit of whole blood and platelets that we collect goes to the laboratory for typing and testing. Each unit collected goes through a battery of about 12 different tests. Blood that we collect is processed in the laboratory. Whole bloods are separated into two components, red cells and plasma. The red cells help patients who have low hemoglobin counts, like our chemotherapy patients, or it could be patients in surgery who are bleeding. Platelets help our leukemia patients and also our stem cell transplant patients. Plasma contains the clotting factors, so that helps patients who may be bleeding or who have other coagulation disorders. Each unit is processed, labeled, and stored in the laboratory. When a patient needs a transfusion, a request form is sent to the blood bank, and we then send the unit to the patient by an underground pneumatic tube system that goes directly to the patient's location in the hospital.
I was doing great for about 3.5 years. Life went back to normal. I was going to school, and then something just, wasn't right, and I wasn't feeling too good. I was actually at the bone marrow transplant reunion here at City of Hope and just got my 3-year button. And then right after that, we found out that unfortunately my leukemia was back and I had relapsed. So I was going to be relying on those blood and platelet donations once again.
Platelets are constantly in need at City of Hope. In fact, we transfuse more platelets than any other hospital in the area because of the type of treatments that we do here that involve chemotherapy and bone marrow transplantation. And platelets have a very short shelf life, only 5 days, so they're constantly in need here. Patients undergoing a bone marrow transplant have very low blood and platelet counts. In fact, the chemotherapy and the bone marrow transplantation process, in a sense, wipe out their ability to create their own blood and platelets. So every donation made here at City of Hope is literally a lifeline for our patients.
My sister is alive today because of blood and platelet donations. She received over 200 units following her bone marrow transplant here at City of Hope, far more than myself or family members could have provided. This gift of life is vital to any patient here at City of Hope, and I'd urge you to consider giving the gift of life.
One of the most amazing things that I've experienced at City of Hope is absolutely the bone marrow transplant reunion. It's when everybody who's received a transplant here just comes together, and it is a true celebration of life. All the struggles that we've gone through, and every year you get to write your number of your years after transplant on a big button. And this year, I'm looking forward so much to getting my second button. Here at City of Hope and on the pediatrics floor, we did a program called Beads of Courage. And we get a bead for each procedure we go through, a round of chemo, and every transfusion we get. And I have about 5 strings of all red beads marking how many transfusions I've had. And looking back and seeing what I've gone through, you know, it shows me how important those are and how much that made a difference in my treatment. And that's what truly saved my life. Because if I didn't have the blood or platelets, I couldn't have received chemo. I couldn't have gone through radiation. And, you know, when you're donating blood and platelets, you're not giving a small gift. You're saving real lives of real people. And I want to say thank you.